Hello everybody. Welcome to Number 1 Doctor Channel. Today video is about salivary glands, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like, share our videos, subscribe to our YouTube channel Number 1 Doctor, and join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free, share and be shared. Today we will talk about salivary glands. The salivary glands consist of the parotid, submandibular, sublingual and other minor salivary glands. The parotid region is that part of the face in front of the ear and below the zygomatic arch. The gland is delineated into superficial and deep portions by the branches of the facial nerve. Hence it is important clinically to recognize that a lump may be in the parotid gland, as simple excision could result in a 7-nerve palsy. The operation to remove most superficial lesions of the parotid, superficial parotidectomy, involves making a long incision in front of the ear and down onto the neck, and identifying the facial nerve as it enters the parotid gland. The branches of the facial nerve are then followed forward and the superficial part of the parotid gland dissected off them. If a parotid lump is easily palpable when examined bimanually with a finger in the mouth, it may be in the deep portion of the gland, and excision is then associated with a much higher risk of damaging the 7th nerve. The facial nerve supplies the muscles of facial expression, so test the nerve by asking the patient to smile, show you their teeth and close their eyes. You must always document your findings. Acute parotitis. The parotid gland is surrounded by a tough fibrous capsule, and when it swells, as in acute parotitis, the stretching of the capsule causes severe pain. This condition may be due to viral infection, mumps, Coxsackie and others, or bacterial infection. Bacterial infections usually arise because of obstruction of the duct, due to calculus, or because of reduced salivary flow, such as in the postoperative patient or sick dehydrated patient from other causes. This is why mouth care is so important in such patients. Acute bacterial parotitis may result in abscess formation. You are unlikely to see a patient with this in an exam. Salivary calculi. Submandibular calculi are the most common type of salivary calculi and may be demonstrated by a plain X-ray or by contrast injection into the salivary duct, called a sialogram. The typical history would be of pain and swelling of the gland in question on eating, due to the production of saliva in an obstructed gland. If the stone is in the submandibular duct in the floor of the mouth, the calculus may be intraorally palpable and easily removed surgically. If it is within the submandibular gland itself, then removal of the whole gland will be required. Parotid calculi are also reasonably common but not usually palpable or easily seen on a plain X-ray. Sialography is usually required to demonstrate them. Remember that the duct opens opposite the second upper molar. Salivary gland neoplasms. Salivary neoplasms are common cases to bring to exams. They are usually in the parotid gland. 75% of all salivary neoplasms are in the parotid. Most of them are pleomorphic adenoma. Pleomorphic adenoma, mixed salivary tumor. This is the commonest salivary neoplasm and also the commonest tumor found in the parotid. 90% of pleomorphic adenoma occur within the parotid. It is called pleomorphic because histologically it appears to be made up of different types of tissue. They are slow-growing and benign, but the tumors have microprocesses which invade locally and make them prone to recurring locally if treated by simple enucleation. They need formal excision by superficial parotidectomy. Adenolymphoma, Warthin-S tumor. This is a benign cystic tumor which contains epithelial lymphoid elements. It occurs in middle and old age and gives rise to a soft, well-defined cystic lump in the parotid. Adenoid cystic carcinoma. This is a highly malignant tumor of the parotid gland. Unlike benign parotid tumors, a carcinoma often causes facial nerve palsy. It is usually hard and fixed on examination, and is often incurable. Thanks for watching our video and hope to see you again in next videos. Do not forget to see other videos in our channel. With my best wishes, Dr. Atef Ahmed.